Low sex drive is often tied to testosterone levels in both men and women. But what we've realized over time is that it's many more underlying things that dictate the sex drive. Those underlying causes lie in 5 areas. One of them is the hormones, and obviously we know that testosterone levels being in the upper end of the normal range, both in men and in women, not only will control sex drive, but also the blood flow to the rest of the body and the frontal lobes of the brain. In women, it turns out that the level of estradiol is equally important. So as the estrogen levels start to fall, the sex drive also starts to fall. So among the hormones, testosterone, estrogen, and estriol, which is also an estrogen, but in women this particular estrogen is critically important for collagen and the mucus production in the vaginal tissues, which is one of the reasons why sex drive in women often drops. The second area is going to be the nutrients, the specific nutrients that are required to activate the testosterone, like zinc, or to activate the estrogen, like chromium and boron. So nutrition is part of the picture for optimal hormonal activation. The third area is the toxins. And although it may be difficult to directly link toxins to your sex drive, but it turns out, for example, that your mood does control your sex drive, and your mood is controlled in a big way by the amount of serotonin you make, and the serotonin is made in the bowel. So albeit it may be a less important function in sex drive, it still has some function. The fourth area is going to be the mind. Obviously, the state of the subconscious and the conscious mind are critically important to sex drive. So anytime we're treating sex drive, we have to look at the state of the mind, the state of the relationship. If the relationship is in poor repair, sex drive will be low. The fifth area is going to be the state of the body. If our blood vessels are in a state of atherosclerosis, then erectile function and clitoral function will not be what they're meant to be, because blood flow is a critical part of the human sexual response. This is where one finds not only a low sex drive, but also low sexual function. So in order to address our sexual function as a whole, it's important to address the underlying causes that contribute to that condition.